Now we're going to do a tibialis anterior origin to insertion taping in order to facilitate tibialis anterior. This is especially good for patients that have weakness with the L4 myotome, possibly a patient following a CBA may have some foot drop or weakness there. This is to help bring that foot into more of that dorsiflexed position. So first we want to identify the tibialis anterior, and the best way to do that is just to ask the patient to bend their knee, and can you bring your toes up towards the ceiling for me? And then at this point we can see the tibialis anterior. What I want to highlight is that the tibialis anterior, the muscle belly ends right around here, and then it becomes a tendon, and so we can see the proximal portion of the tibialis anterior. So this is where we want to start the tape, and we're going to bring that tape all the way down. And you can stop the tape right here if you wanted to. But the problem with that is sometimes when patients are putting their socks on and off or putting their shoes on and off, they will get the bottom of that tape and the edge of that starts to roll up. So my recommendation is to come down with the tape and then follow the tendon, and we're going to loop it around the foot on the lateral aspect of the foot throughout. In order to determine how long of a piece of tape that you need, keep in mind that for this taping, you're going to start up here and they're going to be coming down around the outside of the foot, but we don't want this much tape because we are going to be applying stretch to the tape at roughly 50% of tension. So I'm going to measure out how long I want, and then I'm going to subtract a little bit from that, and that's how long I know to cut the tape. So we'll go here, and then what I'll do with the tape is come around here, I'll fold it in half so that I can create the rounded edges on both sides. So I cut twice and I have 4 rounded edges with that. What we're going to do is we're going to make sure that we do not have any tension on the tail. So what I'm going to do is I'm going to rip the tape, twist and tear, so that I expose that. I'm never going to touch the adhesive part of the tape, so I have that exposed. I'm going to be starting this right there, rubbing that adhesive to melt it into the skin. Now I could pull back on the tape, being careful not to touch the adhesive, and as I pull tension here, I'm going to get the patient to dorsiflex a little bit. I'm applying that stretch as I'm putting onto the skin, and then now I'm going to start to come around, pulling tension on the tape a little bit less as we get throughout here. And now, as we're coming around, we're going to loop it around to the lateral aspect of the ankle. We're going to use this to melt that adhesive, creating some friction and heat on the area. And that's going to be taping for your tibialis anterior.